has a very low failure rate when it is used properly. Now, an alternative to a male condom is a female condom, which is also available, and it is made up of polyurethane. It is physically inserted into the vagina. It is 15 centimeter in length, which has two rings, an inner ring and a small, outer larger ring. And a female can obviously use this condom if the partner is not use male condom. So as you can see in this picture, it consists of two flexible polyurethane rings and a soft loose fitting sheath. So one ring fits loosely against the cervix and the other ring is open and it encircles the labral area. And this can be inserted before sexual activity and you need not remove it immediately following ejaculation. So obviously there are some disadvantages and advantages of these method. The female condom is expensive than the male condom. The male condoms are available and they are distributed by the government free of cost. The advantage of the condom is that they protect against sexually transmitted infection and they can be taken without option and no medical intervention is required. But the disadvantage is that they can reduce some sensation. There is interruption of sexual experience. So this is the disadvantage that some people they don't like using the condoms for. Now the other methods which can be used are the latex barrier covers the upper wall of the vagina, including the cervix, is known as a diaphragm. But the problem is it needs to be fitted by a physician. It is not very popular. In addition, you need to apply spermicidal jelly just before insertion. The insertion should be done up to 18 hours before intercourse, and the diaphragm itself can be left for a total of 24 hours after the intercourse. But it has a very high failure rate. Again, the diagram showing how the diaphragm is placed. The other contraceptive available is a cervical cap, which is one of the oldest methods in contraceptive history. What it does, it caps and covers the vagina, the cervix, so that the sperms are not able to travel to the uterus. The advantage is it can be left in the body up to a total of 48 hours. And it is 6 hours after sexual intercourse. Again, this diagram showing this is the diaphragm which is placed high up in the vagina, and this is the diagram showing where a cervical cap is placed. Now, in addition, there are some spermicides which are available in the market. What the spermicides do, they actually kill or immobilize the sperms in the vagina. These spermicides are available in different forms in the market. It can be in the form of jelly, foam or sponge, or some of them work instantly. The others require a pre-insertion. They need to be placed high up in the vagina. And they are only 76% effective when used alone. But combined with other mechanical barriers, they work better. And they have a high failure rate on their own. So these are the spermicides which are available. Today is a very well-known spermicide that is available in the market. And the advantage is that no prescription is ready. The disadvantage is that it interrupts the sexual experience. Sometimes it can cause skin irritation. There is no protection against sexually transmitted infections. And they are not effective enough to be used all alone. So you need to combine a spermicide with a mechanical barrier. Now, a very popular method of contraception are hormone-based contraceptives. Out of the hormone-based contraceptives, we have oral contraceptive pills, the vaginal ring, transdermal patches, injectable hormones, and hormone IUCDs. The pill is a very popular form of contraceptive. The pill can be either a combined estrogen and progesterone pill, which mimics the menstrual cycle of a lady, or it can be a progesterone pill or the mini pill. Now, how does a oral contraceptive work? What it does is, it makes your body think that you are pregnant. As a result, the ovaries stop making and releasing egg, so they cannot be fertilized. The lining of the womb will not develop enough for an egg to grow in it. Thirdly, the fluid around the neck of the girl, and which it makes it very difficult for the sperm to travel to the womb. So what the oral contraceptives do, they stop ovulation, they thin the uterine lining, and they thicken the cervical mucus. Now, there are so many oral contraceptives available in the market, and different types of oral contraceptives will differ on how to begin. You need to talk to a doctor and take a doctor. Most of the times, the pill is a 21 pill pack with 1 week off and then again 3 weeks on. But you must remember not to skip pills, regardless of whether you are or you are not having sex. So it is important to take it daily. Now there are benefits of birth control pills. Besides birth control, they have a positive effect on the menstrual cycle. They will relieve menstrual cramps. The amount of flow during the period shortens. The periods become regular for those who have irregular periods. In addition, if you have a tendency of ovarian cysts, that gets decreased. There is prevention of uterine and ovarian cancer. In addition, it decreases hair growth and acne as well. So there are some mild side effects which you may experience during the first 4 cycles, which usually clear up subsequently. These are pain, nausea, increase in headaches, moodiness, weight change, spotting, and decreased sexual interest. But usually the body gets used to these pills and then these symptoms. But there are certain women who should not take oral contraceptives at all. They are women who have a history of blood clots, strokes, heart or circulatory problem, those who have liver problems like jaundice, breast or uterine cancer, or liver disease. And the women, it is considered risky for certain women who have a history of smoking, who have migraines, depression, those who have high BP, epilepsy, diabetes, asthma, and varicose veins. For these, it is very risky to use OCs, so you need to always consult a doctor before starting it. Now, besides the combined oral and estrogen and progesterone pill, there is a progesterone-only pill available in the market. This is a very good pill for those who are breastfeeding. It does not have any estrogen component and does not alter the milk quality and quantity. It does not reach the baby and harm the baby. So it contains only one active ingredient, that is the progesterone. The problem with progesterone-only pill is it has to be taken continuously without any break. So it is not meant for the forgetful. Now, besides oral pill, the hormones can be used in the body in the form of ring. A vaginal ring is available in the market, which is a 2-inch ring which can be inserted into the vagina during the periods. Like the pills, it has to be worn for the 3 weeks, and then it needs to be removed for 1 week and then replaced by a new ring. So this is the cycle, 3 weeks on and 1 week off. The advantage is, like the pill, no daily administration is required, but the problem is it is costly and there is no protection from the sexually transmitted diseases, and it is not effective for overweight women. Another hormonal contraceptive which is available in the market is the injectable form, which is known as Depo-Provera. It is a birth control shot which, once given, it works for you for 3 months and prevents pregnancy. It is a very effective method and there is no daily pills to remember. How does it work? It stops ovulation. It stops, sometimes even it thickens the cervical mucus, so the sperms find it difficult to travel up. into the uterus. But there are some side effects. Sometimes the people get extremely irregular menstrual bleeding or spotting for 6 months. Sometimes the periods may stop, and it may be very difficult to periods even after stopping the injections. Sometimes there is weight changes, sometimes there is breast tenderness and mood changes. But mind you, not every woman has these side effects, and sometimes it is very good, especially those who have had a recent cesarean section. It is a very good alternative and a good contraceptive for them. Now a word about emergency contraceptive. An emergency contraception is a pill that can reduce the chance of you becoming pregnant by 75% if it is taken within 72 hours of an unprotected intercourse. So, like I said, when the emergency contraception is indicated? Firstly, if you've had an unprotected sexual intercourse. Secondly, if you feel that the other contraceptive was not used properly, or like a torn or leaking condom, you have missed pills, the implant or injection was given late, or if you are using a patch or ring which gets detached for preventing pregnancy. How it works? That depends on what time of menstrual cycle you take it. So it floods the ovaries with a very high amount of hormone, and this hormone prevents the egg from being released. If the egg has been released, it also alters the environment of the uterus and thus makes it disruptive for the egg and sperm to embed it in it. So it can be either a set of 2 pills which have to be taken exactly 12 hours apart, or a single pill like an eye pill dose, and it has to be taken only once. But you should always take this pill from a physician and not on your own. Always take consultation. And as I told, it is a very effective method in reducing pregnancy. But the advice is that it is not 100% effective. So you must always do a pregnancy test if your period gets late or you vomit within 2 hours of taking this contraception. Now, another popular method is an intrauterine contraceptive device. What are IUCDs? They are T-shaped objects which are placed in the uterus, and these prevent pregnancy. A natural delivery is a must. A child, because it cannot be placed in those who have not born children, and these are inserted just after or just at the fag end of your period, and once inserted, they are very extremely effective. This is where the IUCD is placed. It sits in the you leave a thread hanging from the vagina, from the cervix, for removal whenever it is started. Now, there are 2 types of IUCDs available. One is the hormonal IUCD and the other is the copper releasing IUCD. They work by preventing fertilization. The copper one releases copper ions which are toxic to the sperm, and the hormonal one also does the same. And in addition, they disrupt the normal functioning of and division of the sperms and the oocytes, the eggs. Now, when we look at the cost, pros and cons of IUCD, the copper IUCD is very good and it is cheap. It is given by the government centers free of cost. The copper IUCDs are good up to 10 years. That depends on which copper IUCD you are using. The hormonal IUCD is expensive and it is good for up to 5 years. But for those who have heavy periods, it is a very good option. So you can choose either of the 2 depending on your medical conditions and your requirement. The advantage of an IUCD is that it is very effective. Once you place it, you forget it. There is long-term action. There is no interruption with the sexual activity. You need not remember to use it. You can be used for the during the breastfeeding because it does not at all interfere with it. The disadvantage of an IUCD is that again there is no protection from the sexually transmitted infection. There is a risk of infection. If you are not keeping yourself clean, there is a risk of getting infection, and usually this is within the first 1 or 2 months. And sometimes some people have a little bit of heavy bleeding, irregular spotting in the initial time, and there is a very rare incidence of it perforating the uterine wall and entering it down. Now, let me tell you a contraception, that is sterilization. Sterilization can be performed either on a male or a female, and it is usually done when the family is complete. The female sterilization is known as tubal ligation, and the male sterilization is known as vasectomy. Tubal ligation is a surgical procedure which is performed on a woman. What we do is the fallopian tubes are cut, tied, cauterized, or a ring is placed on the fallopian tubes. The idea is to prevent the eggs from reaching the sperm. It is a very low failure rate, and generally it is a very, but sometimes over a long period of time, some women may start experiencing heavier periods. So this is the diagram showing a tubectomy. This is what we cut the fallopian tube, or we put clips or rings at this in the middle of the fallopian tube, and this prevents the egg which is released from the ovary from entering into the uterus, and the sperm also do not reach the egg. So pregnancy is prevented. Now the male sterilization procedure is known as vasectomy. It is no scalpel technique is available. It is faster, easier, and the recovery is better than that of a tubal ligation with a very little failure rate. So here we ligate the vas deferens of the male private parts. This is again the diagram showing how a sterilization is performed. The vas deferens is cut and a small section is removed, and the ends are tied off or they are burnt. Now the question is, which contraception is right for you? That depends. As I told you, a contraceptive which is 100% good is not available. So you need to see, and you should consult a doctor. And the whole range of contraceptives are available. What you need to see is what your individual risks are. What are the implications of pregnancy for you? Do you have a risk of sexually transmitted diseases? What is the convenience relationship you are having? What is the ease and cost of the contraceptive, and the acceptability in terms of religion? So it is important to know that if you have an unplanned pregnancy, the risk of an unplanned pregnancy, abortion are much more than the minor side effects which a birth control method can give to you. So it is always better to take some form of contraceptive, use it, since if you don't want a pregnancy. Thank you. I'll be happy to answer any questions.